Today we're hosting Navigation Challenge, a Culture and Leadership Conference. We will be welcoming colleagues from our provider, commissioner and regional networks. The day promises to generate conversation on the complex topic of culture. Everything that we work on that is determined by culture. We felt it was a really good idea to kind of come together and talk about culture.
So today I covered a presentation on how you can successfully navigate and influence change and improvement for the benefit of others, whether that's patients, staff or the people that we serve. I highlighted some of the evidence, some of the important enablers and key principles, and also shared some of my personal experiences from working in different contexts in my career.
So today I spoke about being fair and navigating a just culture, specifically thinking about what being fair means, particularly in relation to taking accountability. So thinking of the NHSR's Being Fair document. So 1, sharing what happened with those affected, so patients, staff, families, etc. 2, sharing learning and action with others. So that's beyond that space, not necessarily about what happened, but beyond that space, sharing the learning and how you've put changes in place. And finally, that bit of being accountable is really, really important. You're accountable for making change happen. You're accountable for making sure that these things are put in place and making sure that it actually worked, because it might be that you had a great idea, but in fact, that isn't the solution to the problem. So that's what you're accountable for the future safety of staff and patients.
Wanted to come along and talk about the issues of how do we enable teams to develop, support that culture change that we want to see, and particularly wanted to sort of focus in on how do we manage the potential for conflict, and can we actually enable that change without conflict needing to take place.
Today I'm going to be speaking about 3 key challenges which people face in the NHS. So my presentation is on how to survive these 3 key challenges. The first one is about external impact, the second one is about resource impact, and the third one is about incivility and unfair challenge in the NHS.
The challenges that we potentially face, they've been leadership and they've been the hierarchy as well within the NHS, and how the critical care outreach team, who I manage, have been able to overcome some of them challenges and demonstrate their leadership within our organisation to ensure that the service has been able to be successful.
My key takeaway is that changing culture isn't about one word, about one thing. It's about shifting the space, so thinking about how we interact, how we engage, what our relationships are, how we communicate with people. It's not a one-off thing, it's a journey. It won't happen really quickly, it will take time to happen. It needs leadership, it needs role modelling, it needs people with a passion. It's just really important, and today the energy in the room has been amazing. That passion, that energy, that joie de vivre, actually that's what elevates this to really great work, and that's what can make a huge difference.
So my key takeaway from today actually is the idea that resilience isn't necessarily a positive aspect of working within the NHS, and actually we shouldn't have to be, nor should we strive to be, resilient, and that actually we should be looking more at supporting our staff. I feel that throughout my time as a critical care outreach practitioner in COVID, it was always said that I was resilient, and it was always used as a positive way of describing me. And having listened to some of the talks today, I actually realised that it was the support that would have been much more beneficial in terms of my own well-being, which obviously then has an impact in terms of patient safety as well. So that's definitely something that as I go on my journey in my nursing career, that I will be very aware of, that, you know, describing someone as resilient or using it as a terminology of being a positive feedback isn't necessarily what our staff want or need.
I love events like this. I think they are game-changing in the fact that they allow greater contact between people. You get to see and hear what people really think about the way they work together. I think it allows for spread of ideas much more freely. And we've become so used to, post-pandemic, working on Teams and having large webinars, but there's something very wonderful about getting to know people. And what we tended to find is the number of secondary contacts that you got after events like this really spike. So people emailing, talking, chatting, and I just think it creates that sense of solidarity, which is so useful.
Connection is really important, I think, in the jobs that we do. and time out of busy schedules. So people today are connecting, and in connecting you can learn from others, you can hear different perspectives and take away ideas to support you and enable you to continue the work that you do in your leadership role.
It's fantastic when people come together and they have the opportunity to talk. You just don't get that on virtual forums always. It's much harder, whereas bringing people together around a common goal is brilliant within an environment like this.